Hi everyone, I'm Ansaf, Director of Public Health for Oxfordshire, and today I want to talk about my Director of Public Health annual report for this year. The focus of the report this year will be on tackling excess weight and physical inactivity. As we emerge from the pandemic, we have seen some real significant disruption to our preventative and public health services, and we have also seen lifestyle of our population worsening. Why is this important? This is important because physical inactivity and high levels of obesity are direct risk factors for developing long-term conditions like diabetes, cardiovascular disease, stroke, and cancer, and so on. And if we take no action, we will see our population becoming unhealthy and adding significant stress and demand to our already stretched health and care system. Secondly, this has a massive inequality dimension to it as well. We know the prevalence of excess weight and physical inactivity in Oxfordshire is high, but it's not as high as the national average. However, if you look into our most deprived and disadvantaged communities, you will see the prevalence is much higher than the national average itself. The other thing to also think about is that the causes of physical inactivity and excess weight is not simple as how much you eat and how much active you are. It's multifactorial. Some of the key underlying drivers are the wider determinants issues like the socioeconomic factors such as housing, education, employment, and so on. That is why it is really important that we take timely action in a collaborative way. And thirdly, the key part of this report is I want to bring people together to address this issue. Tackling obesity and physical inactivity is not the responsibility of a single organization. It is the responsibility of all of us, whichever organization that you work for. You will have a key responsibility to address this issue. And I want to use this year's annual report to really bring you all together to address this issue for the benefit of our residents. Our residents deserve to be happy and healthy, and that means having access to healthy food and opportunity to be active. We want to create a healthy place that gives our residents these opportunities, whichever background they come from, whether they're at home, whether they're at workplace, early years, school settings, or any other local spaces. It is timely that we take action right now. The pandemic has seen worsening of our prevalence of obesity and physical inactivity. And if we don't take action, they will continue to get worse and potentially can be a bigger threat than the pandemic itself. But the good news is the pandemic has shown us that we can work together. We can come together and take action to address this issue. That is why I want to use this year's annual report as a way to shine the spotlight on this particular issue and bring all of us together so that we can take action to address this. I hope you enjoy the report, but more importantly, I hope it inspires you to come together to address this key issue. Thank you.